we're recording, and I'm going to let people in. Let's see. Oh, 4 people. Look at this. So at least 2 people, at least 2 of those have dog training in their title. So at least 2 are professional trainers.
All right. It's 5:01. Let them in before they leave.
I think I let them in. Did I do that?
It hasn't said that anyone's joined.
Okay, it says, all right, people are joining. Hello, everyone. If you can hear and see us, either drop a quick note in the chat box or turn on your camera quickly and give us a thumbs up so we know everything is working. Nice. Victoria, welcome, and awesome that we can see you. And Suzanne. So at least 2 people can hear and see us, so that's good. Yeah, I'm gonna wait a little bit longer for more people who may want to join. And then I'll be running the slides because Morgan has had a few tech issues, but she'll be our presenter. Let's see. Hi, Lina.
Hello.
I just realized I will have to go back from the presentation probably after a slide or 2 just to make sure there's no one else who wants to join, because I can't see the someone wants to join list, I think. So I may have to, at one point, maybe I'll let you get through 2 slides and then quickly look back at this bigger screen and let anyone in who may be a little late.
Sounds good.
All right. So welcome, everyone. I'm excited that you can join us live. And I'm really excited that Morgan agreed to do a webinar for us. I've seen the slides and I think they're awesome. And there's some really good information out there on there, some of which was also new to me, because as a person who takes my dogs to the vet, there are things that I did not know that go on behind the scenes, or experiences that veterinarians have that I'm like, oh, wow, that is mind-blowing. I was not aware of that. And yeah, and then, yeah, there's really, so I'm excited that this information will be out there for people who own dogs or people who work with clients who own dogs and may be struggling at the vets. We'll be recording this, and I'll send out the recording if you would like it. For that, just put your email in the chat, or you can reach out to one of us in the last slide. There will be our email addresses. And finally, Morgan said, hold on, I think someone wants to join. No, that was a chat thing. Thank you. Thank you, Barbara. And lost my train of thought. Yeah, so Morgan said, if you have questions about something that is on a specific slide, just raise your hand or unmute yourself and just interrupt her. And if you have a longer question or something that is only tangentially related, put it in the chat box and we'll get to it after the presentation. But for little clarification questions, you can just speak up and raise a literal or emoji hand. All right, ready to get started?
Hey everyone, thanks so much for being here. My name is Morgan Bell. I am a small animal veterinarian. I've been in practice for about 9 years now. Um, I am fear-free certified and low stress handling certified. And I just really have a passion for helping dogs with some behavioral issues kind of feel safe and happy at the vet so that they can have a good vet visit. This is actually my first time doing a webinar or anything like this. So if I'm talking too slow, if I'm talking too fast, if there's anything that's not clear, please don't hesitate to yell out and let me know so I can make adjustments. You all are kind of my um, guinea pigs here. So I have 3 of my own dogs. You can go on the next slide for favor. I have 3 of my own dogs. I have Bubby, Travis, and Mikey. They're all hound dogs. I usually get dogs by just going to the shelter and adopting whoever's making the most noise. So here in the South, that gets you a hound dog. And in particular, Bobby, the little white dog at the end there, has been a really good teacher for me because unlike my other dogs, he struggles a little bit, feeling safe with vet procedures sometimes. So the past couple of years, I've just been, really working to help him feel better about the vet. And I've kind of noticed some areas of miscommunication sometimes that can happen between the training world and the vet world. So I just kind of wanted to address some of those issues if possible. I saw a chat, but it disappeared before I could read it.
Yeah, I heard it. That's why I quickly stopped presenting. Someone's just said they are really sad, but they have to leave because their internet connection is being terrible, so they can't really hear anything.
That's too bad. It'll be recorded, so if you watch it later and you have any questions, please don't hesitate to reach out.
Thank you.
Oh. Next slide, please.
Okay.
So kind of some of the things that I'm going to go over today is some tips for finding a vet that's going to be a good fit for your dog that struggles with vet visits. Just some communication strategies to set your dog up for success and some common misunderstandings that can happen between the vet staff and dog owners. Just briefly touch on some very general information about medications that we can use to help dogs have a better time at the vet. Some different approaches to getting your dog ready for the vet and how to pick which one is going to be right for your dog. What cooperative care and handling skills you should prioritize, and then if you need more help, where to find it. Next slide, please.
Let me just quickly see if there's anyone else who wants to be let in. And everyone close their eyes so you don't have to see the infinity screen.
Sorry about this janky tech setup, guys. If we do this again, I'll try to have a better setup than just joining on my phone.
I think we're good, but let me just double check because
Thanks for understanding.
Thank you. All right. Okay, I think we're good. I'll hop back to the presentation. And we go back to sharing. Okay, you can open your eyes again. Next.
So some tips for finding a vet. I can't see the slides anymore, which is fine because I have them on my computer, but just let me know if I need to go to the next screen.
Okay. Yeah.
Some tips for finding a vet. There's a couple certifications that you can look for. These are just optional, like continuing education things that veterinarians can choose to do after getting their medical license that are really, if a vet has taken the time to go and get one of these certifications, it just shows that they really care about making sure that their patients are, feeling safe and reasonably unstressed in the vet clinic. Fear Free is probably the most commonly known one in the States, and I know in Europe there are several Fear Free certified vets as well. The Low Stress Handling Silver certification that was developed by Dr. Sophia Yin is the other big one. It's not quite as well known as Fear Free. I've done both of these certifications. They were both very good. I think the low stress handling certification was a little bit more just in depth, a little bit more helpful information than the fear free. But it's important to note that not having one of these certifications is absolutely not a red flag in any way, shape, or form. A lot of vets that are, really good with scared dogs and really care about making sure that the vet visit goes smoothly for everyone don't have either of these certifications, and they still do an amazing job. Especially the fear-free one is a little bit controversial because you have to pay every year to keep your certification up, or you can't legally describe yourself as fear-free, which is kind of unheard of in that world. All my other certifications, like I have to do annual continuing education, but you don't have to pay a yearly membership. So for that reason, even a lot of veterinarians that have gone through the program are not able to advertise themselves as fear free because they just don't keep paying yearly. I'm not planning to renew my fear free certification next year, and I promise you that nothing about the way I handle my patients is going to change. So, another great way to find a vet is ask your trainer for recommendations if they have a vet that they work with. And if you are a trainer and you have patients that struggle at the vet, please feel free to reach out to local veterinarians and just kind of talk to them and say, hey, I have dogs that really struggle at the vet. They need a fear-free approach. Is that something that you're able to accommodate? Please don't feel awkward or any hesitation about doing that. People ask veterinarians a lot of dog training questions that, quite frankly, we're not qualified to answer. And it's always a struggle for me to find enough trainers to refer all my clients to, because it's frequent that trainers around here, stop taking new clients for an extended period because they're too busy. And then I have people that need a trainer and I have nowhere to send them. So I would be thrilled if a trainer called me up and said, hey, can I send people to you? You can send people to me. That would be wonderful. So just if you're a trainer, call your local vet, see if you can make a connection. And then my final tip for finding a vet is when you're calling vets, ask if you can schedule a happy visit. Or some places call them victory visits. It's basically just a visit where you're not planning to accomplish any actual medical care. You are just bringing your dog in to kind of meet the staff, get a lot of cookies, get kind of acclimatized to the vet clinic. If you ask about that and the receptionist knows what you're talking about and is happy to get that scheduled for you without a lot of pushback, that's a really good sign that the vet clinic is very used to dealing with, scared or reactive animals and that they have, a protocol in place for that. Next slide, please. So communicating with your vet team when you're scheduling an appointment, please let us know upfront kind of what your dog needs. Like if you know that your dog is scared at the vet and needs a little more time, let us know when you're scheduling the appointment so we can schedule that appropriately, maybe so that we can schedule at a less busy time of day when we can make sure you can go right into an exam room. That'll just make things go a lot more smoothly if we know what to expect. Um, if you're not sure what kind of accommodations your dog needs for like a successful visit, just let us know what you all have struggled with in the past so we can work with you to come up with a plan. And scheduling a meet the vet visit your first time at a new vet is really highly recommended, just so we can kind of make a plan of what's going to happen if your dog needs meds for visits, if we want to only try to do one thing at a time, just that kind of thing. But next slide, please. So safety. One thing that I've not really seen addressed in depth in the dog training community is some of the safety concerns that veterinary staff have. And I'm actually not talking about the risk of injury from patients. I'm also talking about client behaviors. I don't think that most people that haven't worked in a vet clinic are really aware of some of the behaviors that we commonly deal with from clients. Because I know Caden was shocked when I told him some of these things. And I assume that a lot of nice, normal people would also be surprised. Basically, everyone who's worked in a vet clinic for any length of time has probably experienced most or all of these things. They've had a client say that their dog doesn't bite, refuse to muzzle their dog, or insist on holding the dog themselves, and then the dog, less than a minute later, bites or tries to bite. They've been bitten by a dog and then had the client laugh. They've been told, I'm not going to muzzle my dog or pay for sedation because it's your job to get bit. We've had clients insist on holding their own animal, and then when the animal begins to struggle, they immediately let go and allow the animal to bite the vet staff. We've all been yelled at, cursed at, possibly even threatened for asking a client to muzzle the dog, or saying that a dog is too stressed and we need to sedate them or try another day with some meds on board. Yelled at, cursed at, probably even threatened for saying that the dog was too stressed and we couldn't complete a nail trim. For some reason, nail trims are a huge trigger for people. I've had more abusive client interactions about nail trims than pretty much anything else. And yeah, so I'm not just saying this to complain about difficult clients. I just kind of want to give a window for you guys into understanding why you might get some pushback if you tell the vet team that your dog doesn't bite and you feel like they don't believe you. Or if you want to hold your own animal and we say no. It's just because, unfortunately, we've all had experiences where we trusted clients and then we got injured because of that trust. I don't know a single person that's worked in a vet clinic for more than a few months that doesn't have an experience like that. Some recommendations just to help you communicate with your vet team that you're a safe and reasonable person for them to deal with, and kind of get on the same page with what you're going to do for your dog. The first thing that you can do is if you want to go with like a low restraint approach for your dog, or if your dog is anxious or scared or aggressive at the vet, I really recommend bringing them to the vet in a well-fitted basket muzzle that the dog has been trained to wear and is not constantly trying to get off. There's really nothing else you can do that can that is as effective to establish with the vet team that you care about their safety and that you're not going to ask them to do anything that's unsafe for them. It's of all the of all the like unreasonable and dangerous clients, I don't think any of them have actually brought their dog to the vet in a basket muzzle. So that is a huge green flag that you can present to your vet team. Another thing is make it safe to stop. So I really recommend proactively telling your vet team that you are okay with not getting all the needed services done today. If your dog is too stressed out, let them know that you would like to stop and try again another day with some meds on board if your dog gets too stressed out. Because it shouldn't happen, but it does happen that, a doctor or a technician is like, I just don't have it in me to get yelled at about a nail trim today. So even though this dog is freaking out, I'm just gonna hold them down and get the nail trim done rather than have that interaction with the client. Should it happen? No. Does it happen? Unfortunately, yes. And then I also recommend proactively asking about anxiety meds if you think your dog will benefit from that, or if they really struggle at the vet, proactively ask about sedation, because that's another thing that a lot of clients don't, they just don't want to hear it. So your vet staff may kind of postpone that conversation with you until the last minute to see if maybe they can get away with not doing it, which is not really in your dog's best interest. So I really recommend that you be the one to bring it up. Like, hey, I think, Fluffy would benefit from some anxiety meds, or, I'm okay with sedation. We need to do that today for a blood draw. Modern sedation drugs are super safe. It's actually more safe to just go ahead and sedate a really anxious or struggling animal rather than like physically force them to whatever it is done. And I would love to see a patient with a bedazzled muzzle. So I think that's a great idea, that comment that just popped up. And so if I miss any of your comments, just unmute yourself and yell out, because they like flash on my screen for like 2 seconds and then I don't see them anymore.
Yeah, and I can see them because my full screen is the slide.
Yeah. And about the basket muzzle, I also forgot that I wanted to say, I think a lot of people are nervous about bringing their dog to the vet in a muzzle because they think it's going to give the impression that their dog is, a bad dog or aggressive, or, make the vet staff treat their dog differently. I promise you that no vet or vet tech is going to see a dog in a muzzle and think that's a bad dog. We are going to see that you're a good owner who cares about our safety and your dog's safety and is being proactive to make the visit go well for everybody. We absolutely love to see a muzzled dog walk through the door. Like I said, that is a huge green flag for us, and we will not judge you or your dog for arriving at the hospital in a muzzle. Can I have the next slide, please? Okay, so medication. So for this, obviously, I can't give any specific medication recommendations for anybody's dog, without having that patient veterinarian relationship, but I just have like some general things that I can go over. So there are kind of 2 different categories of medication that we can do. There are pre-visit meds, and then there is sedation that we do in the vet hospital. So pre-visit meds, you're going to give it home before the visit. Um, Honestly, I think most dogs would benefit from this, unless you have the super happy dog that is dragging you through the door, wagging their tail, to greet everyone at the vet clinic and doesn't even notice the vaccine because they're too happy, about all the attention that they're getting. Unless you have that kind of a dog, honestly, I think some type of pre-visit anxiety meds would be a great idea. Um, I mean, I got Valium offered to me when I got my LASIK eye surgery done, and I was there voluntarily, knew what was going to happen, and I could have walked out at any moment. So if we offer humans who have so much more knowledge and control about what's going on at the clinic, if humans get offered pre-visit meds, I think definitely we should be doing the same for the majority of dogs. And the pre-visit meds, I mean, they're gonna just kind of take the edge off. They might make your dog a little dopey, walk a little slower. They're not gonna knock your dog out by any means. Your dog will still be able to, get in the car, walk into the clinic and be alert and aware. It's just gonna take the edge off a little bit. One thing to be aware of with pre-visit meds is something called multimodal therapy. All medications have side effects. Those side effects are usually seen at higher doses of the medication. So if we need to get to a certain level of chill, we can do that by giving multiple medications at a lower dosage, in combination. So you get the desired level of chill with hopefully no side effects. So I get that it might feel a little intense to be given 2, 3, even 4 different medications to give to your dog all together. But you're actually going to get a better result with less risk of side effects than if I just gave you a higher dose of one single medication. It's super typical to do a combination of 2, 3, sometimes 4 medications. That's really normal. So don't freak out if your vet gives you a bunch of different meds to give together. And then sedation, which is typically an injection that's going to be given in the vet clinic. This is great for dogs who are very stressed, who even, with lots of cookies and going slowly are just not going to be able to calmly tolerate a procedure, or if they need something painful done, or sometimes given sedation just because of like the length of a procedure that was needed. Like if a dog's getting a bicavitary scan, that can, they have to be still for like 20 minutes for that, and that can be challenging even for a really well-behaved dog. So those are some of the reasons we reach for sedation. Your dog should be fasted beforehand. So if you think that your dog might end up needing to be sedated, just don't feed them the morning before your appointment. These days we have reversible drugs, so we can fully sedate your dog to the extent that we can like do stitches on them. They're out, and then I give them a shot of reversal, and they are awake and ready to walk out the door in 20 to 30 minutes. So it's not like it was 20 years ago where if your dog was sedated, that meant they were going to have to spend the whole day in the hospital. It's now something that can be done in the context of just an appointment. And again, if you think your dog might need sedation, please give the receptionist a heads up when you're scheduling your appointment. We do need trained staff available to monitor your dog the whole time they're sedated for their safety. So it does need to be scheduled appropriately. Can I have the next slide, please? Any questions so far? I feel like I started talking too fast. Okay, so different approaches to helping your dog get ready for the vet. Kind of the more common one that I hear dog trainers talking about is cooperative care. So this is specific trained behaviors. So something like a chin rest to have an exam done, training your dog to lift their head on cue for a jugular blood draw, training your dog to lay on their side on command. All of those things are examples of cooperative care. And typically part of cooperative care is that you'll train an explicit consent signal, so an opt-in or opt-out cue. Probably the most common one I've seen is people will teach a chin rest. So if the dog lifts his head off the chin rest, that's like an opt-out and everything stops. And, you know, as if they put their head on the chin rest, that means that they're okay for you to continue. And kind of the other option is desensitization, which is just acclimating the dog to various types of handling, touching, and restraint. So what this can look like is, for me, when I'm training my dog, I have cookies. I say vet stuff, which is our announcement cue for, you know, hey, I'm gonna touch you or handle you now. You don't have to do anything. Your job is just to tolerate it. Let me do what I'm gonna do, and then you're gonna get cookies for allowing that. You can use an announcement cue or not. You can have the dog restrained during the process or not. And it's just important, since the dog doesn't have an explicit like opt-in or opt-out, that you watch really closely for signs of stress. Could I have the next slide, please? So pros and cons of cooperative care. The pros are that it's good for very sensitive dogs. So if your dog is really upset by being handled in ways that feel unpredictable to them and needs a really high level of control and predictability over what is happening to their body, this is probably going to be a good fit for your dog. Because there's an explicit opt-in and opt-out that you've trained, there's less risk of missing stress signals and accidentally going too far. And then some of the cons are that it needs a really skilled trainer, because you are training a bunch of different behaviors. So, you know, either work with a dog trainer or, you know, a pretty talented owner that's trained more than just like a sit at home. The high specificity of cooperative care, meaning that you're training very specific behaviors for very specific situations, it's not just like general handling, means that the behaviors can break down if anything changes or if anything unexpected happens. Yeah, the head in a pail method, that's a really good option as well. I like to do a front foot target sometimes, because I feel like a lot of dogs feel better if they can look around to see what's happening rather than having their head immobilized by being stuck in a chin rest. So there's definitely a lot of options for what you can use as your consent signal. So an example of how a behavior can break down if anything unexpected happens. This is my own dog, Bubby, who has a heart condition. So he goes once or twice a year to a cardiologist and gets an echocardiogram done, which is an ultrasound study of the heart. It can be done standing, but Bubby is not a fan of that. So I decided to train him to lay flat on his side on the ultrasound table on cue so that he could get his echo done. And so I trained him to lay flat on his side. We practiced doing that in different locations. We practiced doing it on a table. Everything was going great. I thought we were ready. I felt really confident that this was going to work. We went to his ultrasound appointment, And Bubby informed me that he could not possibly lay flat on the ultrasound table because there was a hole in the table. There's a little gap, a small, like this big gap in the ultrasound table for the ultrasound probe to fit through so that the cardiologist can examine the heart, which we didn't have on the table that we worked on in my clinic. And that hole was just a deal breaker for Bubby. He was not able to move past it. So he was not able to offer his trained lay flat behavior that day. So that's an example of even just, one little thing can really derail the whole train with this kind of preparation. Another con of cooperative care is that it's impossible to train for everything. There's just such a wide variety of medical procedures that your dog may need done at some point during his or her life that even if all you did was train cooperative care, there's no way that you could prep for anything. I've been a veterinarian for 9 years. I've been in the vet field off and on for almost 20 years, and I still occasionally see something new or somebody do something in a way that I hadn't seen before. So there's no way to prepare for everything. And then finally, the biggest problem that I see with cooperative care is that to do it effectively, you really need to work with a vet professional as part of your training to ensure the accuracy of the training picture. What I've seen a lot is people that work really hard getting their dog ready for an appointment, training cooperative care skills, and then they get to the vet visit and everything falls apart because something just wasn't quite right about the training scenario. So for example, you've trained your dog to sit and lift up his head for a jugular blood draw. But what you didn't realize is that for us to be able to draw blood from the jugular vein, we need to put our hand at the base of the throat and hold off pretty firmly to raise up that vein. So you didn't prepare your dog for that. The dog felt that pressure on the neck and said, whoa, what's happening? Like you gave me my cue for a blood draw and I did the thing and then you changed things on me and I'm not okay with that. We're not doing that today. So yeah, that's just an example of why if you're going to do cooperative care, you really need someone who knows how to do the medical procedure that you were preparing for to be part of the training team, which can definitely be a challenge sometimes. I mean, I know that there are a lot of techs and vet tech specialists that are also involved in training, but it's definitely not available everywhere and it can be challenging to find. Can I have the next slide, please? And then desensitization, low stress handling. So some of the cons of this is that some dogs really struggle to go with the flow. The idea with this approach is that you just constantly practice giving your announcement cue and then doing different things. So like one time you may, feel all up and down their legs. Another time you may grab them in a big hug and restrain them. Another time you may look in their mouth. Another time you may, put some alcohol on their legs if you're doing a blood draw. It's different every time. And that works great when it works. But some dogs are just not going to be okay with needing to go with the flow like that. So you may not be successful with some of the more sensitive dogs with this. I think it'll work for most dogs, but there's definitely some that I think need a little bit more predictability. Because you haven't trained an explicit consent signal, you do need to be alert for stress signals and have some degree of fluency with dog body language. So those are the cons. The pros are that the flexibility of this approach is really powerful. A dog that has done really well with sensitization training is going to be able to adapt to any situation because They know that the vet stuff's cue means something is going to be done to them, and it's going to be okay, and their cookies are coming. It's easier for a novice trainer to teach because the dog doesn't really need to do anything except just let you do what you're doing. For me anyway, this approach takes a lot less skill than some of the more cooperative care type approaches. And you don't necessarily need a vet professional involved because you don't need to get all the fine details right, because the whole idea is that you're changing things up every single time so the dog knows to expect the unexpected, and that the unexpected is still going to lead to cookies. Can I have the next slide? So common pitfalls that I see when people are getting their dogs ready for vet visits using either the cooperative care or the desensitization approach. Not enough pressure, not enough people, and not enough proximity. A lot of procedures involve putting a fair amount of pressure on the dog's body, not to a painful extent, definitely, but just more, a lot more pressure than you would use in just petting. I see a lot of people prepping for cooperative care and they just kind of like run their hands over the dog, and that's not really the extent of what we do in a veterinary exam. So for example, when I'm examining a dog, I check all the lymph nodes. So I push pretty firmly into the areas where all the lymph nodes are, just so I can feel them and make sure they're not bigger than they should be. There's lymph nodes in the neck, in front of the shoulders, in both armpits, in the groin, and behind the knees. So that's a lot of different places that I have to touch, and touch pretty firmly. Like, again, not painfully at all, but also with a lot more pressure than most people are petting their dogs with. When I'm doing an abdominal palpation, again, it's a lot more pressure than just petting. It's like I'm pushing into the dog's abdomen with my hands to feel if there's anything abnormal in there. So when you are preparing a dog, practicing abdominal palpation at home, I would say see how much pressure it takes to start to lift the dog off the floor, and then just do a little bit less than that. Or imagine that the dog has swallowed a tennis ball and you are trying to push on their stomach forcefully enough that you are going to be able to feel the tennis ball buried somewhere in their stomach. Because basically that is what we're doing. We're feeling if there's any weird masses in there. And then I already mentioned, holding off for a blood jaw. That's a fair amount of pressure on the neck, enough to actually, like if the dog is sitting and you put that pressure, the dog is going to rock back a little bit. Like that's to really get the vein to pop, you do push pretty hard on the neck. So that's pitfall number one. Pitfall number two is not enough people. There's usually going to be like 3 people probably involved in everything. The owner, who's going to be, giving the treats or just is there for moral support. A vet tech who's there to restrain or just kind of be there as an extra person for safety reasons. And then the veterinarian doing the exam. So if you can borrow people to extra people to your training sessions, that would be great. Make sure your dog is comfortable with one person in front of them and one person behind them or to the side of them, and try to make sure that the dog is okay with someone kind of leaning over them as well, because that's going to be, if they're not on a table, that's going to be necessary for the exam too. And then the final one is not enough proximity. So if you could go to the next slide. So I took these pictures. Travis was a good sport. I took them with a spoon because I forgot to bring home my ophthalmoscope and otoscope from the clinic. So yes, that is a spoon that I'm using and pretending is medical equipment. So this is how close my face is to the dog when I'm doing an eye exam and an ear exam. And this is something that I think a lot of cooperative care information aimed at dog trainers gets wrong. I actually just finished up through Karen Pryor Academy. They have a program about cooperative care called Better Veterinary Visits. I just finished that up, and it spent a lot of time going over like how to get the dog to not be scared of the ophthalmoscope and the otoscope, but it made absolutely no mention of getting them used to a human putting their face, very rudely right into their face. So that this is actually something that I've seen missing from a lot of training programs, training advice about cooperative care is, prepare them for a stranger being all up in their face. Because you can see like my chin is actually like past his nose. Like I'm almost touching him in that but in that picture of the ophthalmoscope. So that's definitely something to work on as well, no matter which approach you're taking. And this is one where I know a lot of people like to do like no restraint exams for their dogs. But this exam for the eye and the ear is one where I think it is good to prepare your dog to tolerate restraint, because even if a dog is muzzled, being muzzle punched right in the face by a dog that's gotten upset with you is no fun. And I actually know a veterinarian that got a concussion when a Rottie freaked out while she was doing an ear exam on him. So I think it's actually pretty, I'll do an exam with no restraint, like if I know the dog or if they seem super calm, but if the vet's not super familiar with your animal, I think it's really reasonable for them to say, no, I'm actually going to have my technician restrain them for this exam and not be comfortable with them just chin resting or whatever. So hopefully y'all can be understanding on that. Because also, like when I'm looking through the scope, I have to close one eye, so all I see is what's through the scope. So I'm completely blind to the dog's body language when I'm doing that. Like I can't see if they're giving me whale eye or anything like that. So if the dog does start to get upset, I'm not gonna know unless somebody tells me until I finish my exam. So just wanted to mention that because I think that's the area where there can be some misunderstandings, where the vet is trying to advocate for their safety and the pet owner is trying to advocate what's going to make their dog comfortable, and there can be some conflict around that. Next slide, please. And these are just things that I couldn't really fit anywhere else, but that I think are often overlooked in some of the materials that I've read or watched about cooperative care. Sorry. I've heard a lot of people say like, oh, my dog will let me trim his nail, but we just can't get past doing one nail at a time. One nail at a time is enough, I promise. Most dogs have 18 toenails. If they have dews or double dews, they might have 20 or 22 total. And most dogs need their nails trimmed like once a month or even less often. If you just trim one nail every other day, you will keep up with your dog's nails being trimmed. So if your dog will let you trim one toenail, that is plenty. You don't have to stress yourself and your dog out by trying to push past that unless you just want to. I really would like for people to see if they can acclimate their dogs to being on a table a little bit more. A lot of clinics these days have hydraulic lift tables, so we can even get the bigger dogs up on a table. Or if your dog does not think that a moving table is safe and acceptable, you can train a bigger dog to put their front feet up and then just boost their back feet up. If you can get your dog to tolerate being on a table, your veterinarian will love you. Our knees and our back will love you. I'm only 35 and my knees and my back already really hurt sometimes after a long day. And I love this job and I would like to keep doing this, until I'm 65 or 70. And I'm sure there's going to come a time where I just can't get on the floor with patients anymore. So yeah, if you can get your dog used to being on a table, you will be everybody's favorite client. Um, let's see, beeping sounds, especially with the proliferation of the wireless fences with the shock collar that use the beep as a warning. A lot of dogs are scared of beeps. And unfortunately, lots of things in a veterinary hospital go beep. Fluid machines, x-ray machines, thermometers. There's a lot of beeping constantly happening in a vet clinic. At Bubby's cardiology appointment the other day, I was just talking to the cardiologist. She had tried to disable the beep on her ultrasound machine when she captures an image, and she couldn't do it. And she was saying that like a lot of her patients would jump every time she captured an image, and it just made things really difficult. So yeah, if you can desensitize your dogs to beeping, that's really going to help them, especially if they need imaging done or need to be hospitalized or anything. Getting dogs used to the cone of shame ahead of time can be really helpful. I always feel bad for dogs that have never been in a cone until we put it on after a surgery, and they're still kind of drunk and they're trying to walk out the door and also figure out how to walk with the cone for the first time, and they're staggering and catching the cone on the door frame. And then a lot of dogs are scared of it too. So if you can just kind of take a minute to desensitize your dog to the cone before they have to wear the cone of shame, that would make their life easier. If your dog is super stressed at the vet clinic, they are going to have a lot of adrenaline in them at the exam. And that means that if they're limping at home, they may magically stop limping at the vet clinic. If they're coughing or wheezing at home, they may magically stop doing it at the vet clinic. So if your dog is doing something like that, take a video and then bring the video to the appointment to show your vet. It just helps us get a better diagnosis and makes our job easier. And then the last one is I recommend that you get a yoga mat and do all of your vet prep training on the yoga mat, and then bring the yoga mat with you to the vet. At the vet, all of our floors and tables are slick because they have to be so that we can clean them. We have traction mats at the vet, but honestly, keeping them clean and keeping them from disintegrating under dog claws is a constant battle. And frequently I go to get a traction mat for a patient and we don't have any clean ones, even though I just ordered more like a week ago and they all magically disappeared. So you can solve that issue by bringing your dog their own yoga mat that's going to give them traction in the exam room, so they're not slipping and sliding all over the floor. It'll be something familiar from home that they'll recognize and just help them chill out a little bit. And yeah, that's it for this slide. Next slide. Okay, so priority. What to train first, because there is too much for anybody to do quickly. Priority number one is a muzzle. So if your dog can calmly wear a basket muzzle, they're going to be able to safely get an exam done. They will let a stranger walk up and touch them on the back leg. That's great because now we can get injectable sedation. So if your dog can wear a muzzle and let somebody touch them on the back leg, that's great. Now we can do injectable sedation. They can have their exam, blood draw vaccines, whatever they need while they take a little nap. and I can reverse them, and they can walk out and go home without having to put up with anything too scary. So those are the two that I recommend everybody start with, because if we have those two things, we can accomplish pretty much anything else that we need. The third thing is eyes. Practice putting in eye drops. Pretty much anything else you may need, I can do under sedation. Like I can do a nail trim under sedation. I can do an ear cleaning and like a leave-in medication under sedation. But eye medications generally have to be put in multiple times a day, sometimes like 4 or 5 times a day. I don't have any oral meds that I can really give that will affect the surface of the eye because the cornea doesn't really have a blood supply. So if your dog needs eye meds and your dog won't let you put the eye meds in, unfortunately, I really don't have an alternative for you. You got to make it happen. I mean, there's like a subpalpable lavage system, but that's not something that's going to be widely available. You're going to have to go to like a specialty hospital for that, and a lot of dogs don't tolerate it well. So next thing is just like a general trainers supply those single-use drop disposable drippers. Yeah, so what I tell people to do is just go to the drugstore and just get a bottle of artificial tears and just practice with that, because it's not, you can put a whole bottle of artificial tears in a dog's eye, you're not going to do any harm. And the dropper is similar to what most eye meds come in. So that's a great thing to practice with. Can't share between. Yeah, I mean, honestly, it costs like $2 or $3 a bottle. I would say just get one for every dog to have their own. And then the next thing I'd recommend is just getting them used to handling so they can just have a really good, thorough physical exam. It's, I can't really tell what hurts on a sedated dog. So if I have to sedate your dog to do an exam, that can make it a lot harder to get a diagnosis. So that's a good thing to work on when you have the other 3 skills in place. And if your dog is, diagnosed with a chronic condition or anything like that, ask your vet what kind of procedures they may be done in the future so you can start preparing for that. And okay, next slide. Thinking Canine, did that answer your question? What about the eye drops? So yeah, I think we have come pretty much to the end of the slide. This is just more resources. Hayden, our wonderful host, can definitely help you with any like specific training needs you have for your dog. The Muzzle Up Project is a really good resource for muzzle training, and they also have a Facebook page where you can post and get help with finding a muzzle that fits your dog really well. A couple books I found really helpful are Cooperative Care by Deb Jones, which is aimed more towards pet owners. It's very accessible even for no one with no prior training experience. And then Cooperative Veterinary Care by Monique Fairchild, and I left her credentials off of there. She is a veterinary technician specialist in behavior. Is really like some in-depth, great information about training, more geared towards like dog trainers. And there is a cooperative care trainer certificate that is pretty new. I think it only became live last month. I'm working on mine. There's not currently like a directory of trainers you can look at, but Deb Jones has a PDF on her Facebook page that she is updating intermittently to a trainer near you, or that it's doing online consults. American College of Veterinary behaviorists and the Academy of Veterinary Behavior Technicians are both good resources if your dog is really struggling and you really want that help that has the behavior experience and also the medical experience. And then finally, ask your veterinarian if they have a local trainer that they work with that they can refer you to.
All right. Let me stop sharing so you all don't keep seeing the infinity screen.
Thanks for hanging in there with me, guys. That took me longer to run through than I anticipated.
So thank you so much, Morgan. Lots of great information. Anyone who wants the slides, put your email in the chat box or reach out to either one of us. Okay, I just removed the slide that has our contact info. Let me just get it back real quick. So if you want to jot down our emails, here they are. So Morgan and me, and we both have the slides, so you can reach out to either one of us. What? I think it's the infinity screen again, is it? No, that should work.
Yeah,
Yeah, I can't look at it. It's like, yeah. And I'm gonna I can only see the slide right now. In a second, I'll remove it again and stop presenting and grab emails from the chat. I promise you're not signing up for anything. I'm not putting you on my email list or anything. If you want that, let me know specifically. Otherwise, the only email you'll get is the one with the slides. I hate when people advertise to me, so I feel like I need to warn people that this is not happening. No worries. Okay. And let me see how I stop presenting before anyone has a seizure due to the infinity screen. Okay, here we
Does
go.
anyone have any questions?
Yeah, so if anyone has any longer questions or tangential questions, put them in the chat box, or you can unmute yourselves now and just ask them. We'll give you a little bit of time.
Thank you guys so much for showing up. Like I said, this is my first webinar, so constructive feedback is definitely welcome. And yeah, thank you for being here. I was a little bit nervous that nobody would show up, so.
Yeah, thank you for joining, and thank you so much, Morgan, for doing that. I think it's it's information that would be really helpful for both dogs, trainers, clients, and vets. So hopefully a few folks and dogs experience is going to be better the next time they go to the vet. And yeah, the trainers among you, yeah, I hope you can grab something useful from this for your work with your clients. And like, I think the beautiful thing about that is also there are many ways to train or get dogs used to handling, and you as the trainer, you know your client, you know the dog in front of you, and you can work with them or with whatever methods you prefer. But you really need to know what exactly is going to happen and what is likely to happen and how the picture looks like. And for example, I know that as a trainer, I wasn't aware of how often vets get bitten and how likely clients are to just let go of their dogs, for example. So this is something, knowing this, that I can tell my clients to please not do and keep in mind.
Yeah.
And also things like the proximity, for example, like, yeah, that's information that even as a trainer, if you're not constantly surrounded by this equipment and by this kind of work, you don't think of that, or I don't think of that, right? So that's a really good reminder that, and I mean, totally understandable. I feel like if I'm like looking, if my job is to do an eye exam or an ear exam and I don't know the dog, or I don't know the dog well, and I'm not this dog's trainer, I'm the dog's veterinarian, of course I want that dog to be muzzled. So again, there are many ways to get dogs used to muzzles and many approaches, and you just pick yours as an owner or a trainer working with clients. But that just is really like an important skill for dogs to have. Because if they're not used to the muzzle, it's just harder to examine them. I don't think they're going to be traumatized when, like most dogs anyways, if you put a muzzle on them and they're not used to it, but it's going to require more restraint and more force on everyone's side, and it's going to be more stressful, and that's just not necessary because you can get them used to it in a less stressful context.
I can't see the chat from this screen, so I don't know if there's anything in there.
The Thinking Canine dog training said, let me know if you want to review for promo. It's an important topic.
Oh, I really appreciate that. I hadn't thought about it, but yeah, that would be great. And once I believe the recording is going to be posted on your YouTube channel, Caden. Yeah, I mean, please feel free to post the link to the video like anywhere if you're in any dog training groups or groups for dog owners. I know I kind of randomly jumped from topic to topic, but I feel like there are some kind of gaps that I've seen in common across a lot of different resources aimed at dog trainers and dog owners about getting ready for the vet. So yeah, feel free to share with anyone you think may be interested. Post a link anywhere you would like. Yeah, so thank you very much for that and for your questions and comments during the presentation. I appreciate it.
Yeah, so the recording, as soon as it's finished processing, I will send it out with the slides. And in any case, you can find it on my YouTube channel, which is YouTube/@adventure-dogs. Yeah, as soon as I get around to uploading it. All right. If there are no more questions, thank you all again for joining, and thank you again, Morgan. And yeah, have a lovely rest of your day.
Thank you. Is it just us now?
Let me just stop the recording.